Hi there, and welcome to Canceling COVID. Hey, we're having some technical difficulties. What can I say when you rely on technology? It happens from time to time. We are hosting a platform that gives you a real look, completely unfiltered at COVID 19 and its fact impact that is on our community. As we are continuing now to talk about our families, our businesses, and our way of life, a national update for you. One American dies from COVID 19 every 33 seconds. That's about 2 deaths per hour, and that's quite a bit of death and quite a bit of suffering that we're experiencing here in our country at the moment. Over 3,700 people died on yesterday. We're talking about husbands, wives, family members, uncles, aunts, brothers, sisters, something to put really a real face on how we're being impacted. And there are currently 21.1 million COVID cases in the US, and that's quite a bit. At least 128,000 COVID 19 patients were hospitalized nationwide as of Monday. And hospitals in major cities such as Los Angeles, they are either at or near capacity. And imagine calling for medic and you're not able to get help. They're basically turning some patients away. And then there's the issue of having to see about even if they could release someone if they had oxygen to take with them. That's another issue that's impacting us. And not to mention that the new mutated form of the virus has arrived in Georgia. Needless to say, that's very close to the Carolinas. Now, for a local update, here in North Carolina, we actually hit 7,000 deaths. And that is quite a bit of deaths as a result of COVID. Again, this is Real Talk, our opportunity to have a conversation with you from a trustworthy source about how it's impacting our community. 578,000 COVID 19 cases in North Carolina, almost 67,000 reported in Mecklenburg County, and there's been at least 600 deaths as a result. Right now, the state is in phase 1B vaccinations that allows people that are 75 and up to be vaccinated. Governor Cooper and the coronavirus task force, they will update the state at 3 p.m. Today. They are expected to discuss the next phase. And that's the next phase of vaccinations. And also keep in mind that modified stay-at-home order, where well, it's scheduled to expire on this Friday. So what we want to start with now is talk to an elder in our community who's eligible for a vaccination. I want to bring in Miss Gladys Henderson. Everyone that has a Gladys in their family. She is a 77-year-old, and she's taking the time to talk with us about phase 1B because vaccinations are now being offered to our elders who are 75 and older. And I understand you are 77. So I want to know if you plan on taking getting the vaccination.
No, I'm not,
Okay, and can you tell me why you're not planning on taking it?
because I'm kind of skeptical about it. It just came out, and a lot of this stuff just come out later on down the road. It creates another problem, and I'm not. I no, I'm not taking it.
Okay, so what are some of your concerns if you go in and get the vaccine? You just said you're skeptical. You think there may create some other problems down the road. And along those lines, is it just because you think it may create some other problems?
Yes,
Okay, so
because
simply because
stuff come up now. We're in one medicine don't agree with others, and I no, I don't want to take it. It haven't been out long enough to see really what's gonna happen.
so, Miss Henderson, your concern is there hasn't been enough research as far as longevity
That is
to create
correct.
some data.
That is
Okay,
correct.
do you have any underlying health conditions as a 77-year-old?
I have trouble with blood pressure, but I got it. I have it under control because I listen to my doctor and I do what they say. And the last couple of times I went to the doctor, I hadn't been taking my medicine, and he told me I was doing perfect
Okay,
because I've been following the rules. That's the same way about this COVID-19. I've been washing my hands and doing what they say do and wearing my mask. So
okay.
no, I'm gonna have to see a little further before I decide to take it.
So interesting feedback from Miss Henderson about her take on getting the vaccination. Now, have you considered though that your decision not to take the vaccination could be a matter of life or not living?
I'm just not ready to take it right now.
Okay, I understand that. And one additional question is, are there any steps or any measures, anything that our health professionals could possibly do that would change your mind?
Uh, I have to see further. I need to
Okay.
see further from what might happen.
So that's Miss Gladys Henderson from our community. And again, everyone's got a Gladys in their family. And we certainly appreciate you joining us, taking the time to share your take on the vaccination. So thank you. Continue to take care of yourself.
And what I have another question.
You have a
My
question for
question
me?
is, if it's a lot of lawsuits and things about that, are they saying that you don't have to take it? And see, that would clear them, especially an older person like me, if I take it and my children decide something come up a couple of years later down the road, and it was a mishmash of chemicals, and something went wrong. And that's one reason I'm not going to take it, because they explain to you that you don't have to take it.
So that's another valid point. And if I understand what Ms. Henderson is saying, is oftentimes we see on years down the road where research has come out now and people are impacted by medicine. And then you see a group of lawsuits that are happening. So those are legitimate concerns, Ms. Henderson. And I appreciate you taking the time to talk with us. Again, Ms. Gladys Henderson, she's 77 years old. We're in phase 1B. She's not planning on taking it. So thank you for taking some time out of your afternoon to share those thoughts with us. And I'd like to add, Miss Anderson's not alone. There is research that says that quite a few of our elders, or especially in our community, are not considering taking the vaccination just yet. Let me tell you from our poll that we have on our Facebook page, we have 20% who say they will not take it. Another 20% say they're not sure. 60% say they will be vaccinated. That's the poll that we're holding on our Facebook page. Please head over there. We'd love to get your feedback on that as well. Nationally, Americans appear to be reluctant as well. The Pew Research Center says about 35% of African Americans plan to take the vaccine. And last month, there was a collaboration with the NAACP and Unidos US. And out of that, the research showed only 18% plan on taking the vaccine and 40% saying they don't trust the effectiveness. So with that said, and of course, we've got our public health officials who have their work cut out for them. They're working really hard to try to address this issue so that we can get a hold on COVID-19. I've given you the numbers and they're just destroying our community. So joining me now is Dr. Raynard Washington. He's Deputy Health Director at the Mecklenburg County Health Department. And I first of all want to say thank you so much for coming back and joining us. We really appreciate you coming on to help address these issues. Now, you heard from Ms. Henderson and you can hear the apprehension in her voice. You know, what is the health department doing to try to reach people who feel like her, who feel this way, especially now that we're in phase 1B?
Yeah, so thank you, Tony, for having me back again this week. We are certainly working to, number one, get one essential and critical message out to our community that this vaccine has been tested, that it's safe. It's been proven to be incredibly effective, even more effective than some other vaccines that are more common in our community. And we believe that it's safe. We believe that it works. And we want everybody, when it's their turn, to be able to jump straight in line to be able to get it. We fully know and are aware that there's those like Ms. Henderson in our community who we still got some work to do, right? I mean, to make sure that they're safe and comfortable. And we are working to make sure that they have all the information available, that we're being as transparent as possible about what we know and what we do.
So, Dr. Washington, let me ask, when you say all the information, so what type of information would be available for someone like Ms. Henderson where she could feel a little bit more comfortable? Because you heard her when I asked her if there were any steps or any measures, she's like, no, I ain't hearing that.
Yeah. So the most important thing to share with folks is sort of the process that's taken place. There's been a lot of noise, I think, about this as Operation Warp Speed and what that means for this process. And I want everyone to know and understand that this vaccine has gone through, the first 3 phases of clinical trials, just like every other vaccine that we have in our community. And there has been no significant safety concerns from those trials. And just being completely transparent. And it really, with everything that we try to communicate, you have to break it down to the most simplest elements as possible. And if we have to start at A and go all the way to Z, and it takes us several weeks or months to get folks comfortable, then we'll do that. And we want to instill trust in our community. We want to work in partnership with those in our community who are trusted leaders, our pastors, our community leaders, the ice cream truck guy, whoever will be able to help us talk to folks about the safety, effectiveness, and really be leaders and show, hey, I'm getting it because I know it's the right thing to do. I know it's safe. I feel comfortable. and also making sure that it's easy to access.
So speaking of access, our seniors, phase 1B kicked off today. I know over at Bojangles Coliseum. Can you kind of walk us through our seniors that are going to get it, and how does it actually work for us here in Mecklenburg County?
Yeah, sure. So the county, of course, as well as our two health systems, are still continuing to receive weekly allocations of the vaccine. And so both health systems in the county made available appointments beginning this morning for individuals to come and receive the vaccine, those who are 75 years and older and live here in Mecklenburg County. With the county, a bit of good news, yesterday when we released our appointments yesterday morning, within the first 2 weeks of appointments were filled up. And so we extended it out through the end of the month. And within throughout the day, all of those appointments were actually taken. And so that was just the first batch of about 5,100 appointments for the county's allocations. But both of our health systems also received large allocations and will continue to do so. So their appointments started today and opened up. I know Atrium had a drive-through clinic this morning. I know Navant had a small clinic yesterday evening as a trial run. And so we are working right now to make sure we consolidate the access information for all three of those points of appointment systems so that folks can have it at their fingertips and make that available to those in our community who are engaging with our seniors to make sure they have it. So that's from the Charlotte Housing Authority to folks who live in senior living facilities or independent senior apartments, just to make sure it's as easy as possible. Also,
So
working
Dr. Washington,
with community partners like the pastors who can help folks make appointments. And working to make sure that's available to folks as well.
So there's a plan, because clearly the expectation was to have at least 20 million vaccinated by this date, and reports are showing we're well short, maybe close to 5 million. I know the National Guard, Governor Cooper is deploying them to also help to assist to get people vaccinated. Has the county had any conversation with the National Guard or have them involved as well?
Yeah, actually, great question. So the National Guard, North Carolina National Guard, has been deployed here in Mecklenburg County actually since late October, early November, helping us with our testing operations and our general COVID response. So that same team of National Guards persons are on site at the Bojangles Coliseum, where we're holding our clinics Monday through Saturday, 8:30 to 4 p.m. And they're helping us out hand in hand. They're helping with logistics and registration and non-clinical roles that they can serve. So if you come to Bojangles, you're very likely first be met by a National Guards person who will help you out get through the initial phases of the process.
Wow, that's quite impressive. And now that you mentioned that, I was out at the testing site and I did see the National Guard out. So it's great to see they are involved in helping everyone to get everybody processed. I just want to throw in and add, I know over in Gaston County, they are getting ready to start their testing, I believe at the farmers market on this Friday for those that are in Gaston County. We see people that have hopped in the chat. If you want to ask a question, please, we have Dr. Raynard Washington. He's a Deputy Health Director with Mecklenburg County, and we're certainly glad to have him on here. This is Real Talk, folks. Conversation where you can ask one-on-one whatever you need to know so that we can help get these numbers down. We plan on canceling COVID, and we certainly need your help in accomplishing this goal. Now, Dr. Washington, I want to talk about the current COVID cases in the county. You heard the numbers. You have the numbers. I got them from you guys. And these new numbers, how do they compare to what we have now compared to what happened before the holidays?
Yeah, unfortunately, the situation here in Mecklenburg and across the state and really across the country is getting to be a lot more stressful. We are seeing elevated case counts on a daily basis. Unfortunately, our percent positivity, which is an important metric of how much infection is spreading in our community, is also really elevated right now at high highs, as well as the number of people we have hospitalized with COVID-19 complications in Mecklenburg has increased exponentially over the last several weeks. So we are certainly concerned. We know that at least part of this is due to the Thanksgiving and Christmas and New Year's holiday season with folks gathering. We certainly advise and continue to advise people not to gather and to not be around folks they don't live with, to continue to comply with wearing the mask. We have a long road here ahead of us with the vaccine distribution. As I think I mentioned earlier, we're getting about 2,000 doses at the health department every week, which of course is not enough to get all 1.2 million residents vaccinated quickly. So we are, it's a light at the end of a tunnel, but it's a really long tunnel. And so we really need our community to do the right thing here and help us by wearing masks, sanitizing our hands and surfaces, waiting 6 feet apart, and really just avoiding gatherings. And if you don't have to leave home, if you can stay home and avoid contact, that's your safest bet.
So
Because
we
right
had
over here.
Miss Henderson on earlier, Dr. Washington, and you heard she said for now she continues to wash her hands, wear her mask, and she practices social distancing, and she only stays at home, leaves home if it's necessary. For a 77-year-old who's a little bit hesitant, and that's how she chooses to handle it for now. Obviously there is no way of predicting whether she'll be able to get it or not, but this that individual, is that someone you can say, okay, at least she is practicing the protocols that we've laid out?
Yeah, and that's the best thing to do. And even for our community members who are getting vaccinated right now and getting vaccinated today, they still have to practice those safety measures. We certainly the vaccine is a 2-dose vaccine, and its greatest effectiveness occurs when the individual after the second shot. And so folks still have to be safe. They still have to wear their mask, and they still have to socially distance. Again, because you don't want folks interacting and still being able to transmit the virus on their hands and surfaces.
And Dr. Washington, I know I'm asking a lot of questions, but I'm just taking advantage of having you here. Again, he's the Deputy Health Director with the Mecklenburg County Health Department. And I will say this shows your commitment, the county's commitment, this platform. And when we talk to you, it's like, we're going to do whatever we can to get the word out. And so what are some other ways have you guys gotten creative as far as the health department in getting this information? Now, I know you have a lot posted on your website, but people are really challenged with a lot of financial burdens right now. So perhaps, the internet is not a necessary
Yeah.
or a necessity that they have at their disposal.
Yeah, so we're using every possible channel. So we're using radio, TV, digital, places where we know people are, right? So we recently, just yesterday, hosted in partnership with Novant Health and Atrium Health, a town hall with a group of faith leaders. We're really working with them to make sure that in their programs, they are able to put announcements about information, that they have the materials that can be distributed, they understand what it means, and are really become great advocates for us. The newspaper, I mean, wherever we know people are looking, we're taking advantage of all of those outlets. And so it's not just the website. We're making sure we have materials in multiple languages, and then really working on the ground. We have a number of community organizations that work with our seniors and others, and really leveraging those relationships that we've had and continue to have as our best way to get information out to people.
And Dr. Washington, I want to ask one additional question, and this came up last week. We had Dr. Ben Aquara on. He's with First Care Medical, and we didn't get a chance to answer the question. And hopefully, this is not one that I had expected to ask, but we've got a few more minutes. And the question from someone was, can you get COVID-19 more than once?
Yeah, so at this time, we do believe that individuals, there have been a number of individuals, at least 50, even in Mecklenburg County among our residents, who have been potentially reinfected. And that our definition for that is folks who have had the virus at one point in time, they've recovered fully, and so it's been at least 3 months since their first infection. And then they come back, they test positive again on a molecular test. So not antibody test, but they actually have an active infection, or the test that tests for an active infection. So we do have a number of folks who have been what we would consider to be potentially reinfected. And so we do think that that's possible, which is why it's so important. And everybody's body and immune system is different. So even with COVID-19 antibodies, it's really unclear how many antibodies or how long those antibodies last and how much protection they offer. So it's really important for folks to continue to always do those things we just talked about, the 3 W's, and avoid gatherings. Even if you've had it, even if you had the vaccine, that's going to be essential to getting us through this the next several months and really getting over this hump of this pandemic.
Dr. Washington, again, thank you for taking the time to talk with us. I'm going to check our chat and make sure if we've got anyone else that is interested in asking a question. I'm checking here. Of course, we're working on getting a hold on this COVID-19. Do you guys have any projections? The guest we had last week says, look, we're going to be wearing these masks a lot longer than people expect. I was hoping at least by the spring, but from the conversation that he shared, it's like these masks, they're going to be a part of your wardrobe for quite some time. And that's not good news.
Yeah, I think so too. I mean, I think it's really hard to obviously predict what's going to happen, but I think for right now, we all need to get really comfortable with them. Like we get comfortable with other stuff we have to wear every day, watch and other
Yeah.
apparel that we wear. It'll come a part of who we are, at least for now. And I think if you take a look at what happened with the flu season this year, it's been fairly mild. And we know uptake of the flu vaccine got better this year because of a lot of the awareness that was done. But also certainly the masks offer a level of protection to keep germs that spread in the air lower. So I think they'll be with us for a while. So
Yeah.
folks kind of comfortable. Make sure you get a nice array, a collection that matches your attire.
Well, easy for you to say. You don't have to
Have
put
some fun with it.
lipstick on. That's one of the
Yeah.
well, ladies are like, I can't wear lipstick, but that's kind of
Well, I
vain.
think the
But
mask might be a little bit cheaper than lipstick now.
yeah, you're right. Well, I certainly appreciate you again taking the time to talk with us. I don't see any other questions in our chat,
Of course, my pleasure.
but we do have hopped on and really appreciate. Yeah, we appreciate the information that you're providing. And we'll be calling on you again. So again, Dr. Raynard Washington, he is a Deputy Health Director at the Mecklenburg County Health Department. And I must say too, even with the Director, Gibby Harris, you guys are very supportive. You've been very accessible and great to talk to, reach out to, even for my radio show. He mentioned the radio ads. They are a part of that. They sponsor just whatever it takes to get the word out. They work with a beautiful individual by the name of Donna Raleigh, and they're working in our community to make sure that we are educated. We've got our Facebook poll. It was great to hear. Again, 60% say they plan to get vaccinated. 20% say they do not. Another 20% say they are unsure. If you're visiting and checking us out for the first time, take the poll. We'd love to have your take on whether you plan to get vaccinated. And as we start to wrap things up, you can see across the bottom of the screen, we are scrolling some information. We're in phase 1B now, and here's an opportunity for anyone 75 and older to get out and get vaccinated. Also, you can find on the screen where you can go for testing sites. I feel like at least everyone should at least know whether they are COVID, if they have it or not. That number again is 980-314-9400, because you may not have any symptoms and you may be a carrier that's spreading it and don't even realize it. And that's something that you should be aware of. So if you just take a few moments to get tested, that certainly helps. We've got so much more to talk about. We'll be back here on Friday. We certainly hope that you'll join us as we continue to keep you informed. Real Talk, a platform with reliable information, because we plan on canceling COVID. We want you to help us do it in the process, something so important to our community. As I wrap things up, I always ask that you always take all of the challenges, and they should make you better, not bitter. Thanks for watching Canceling COVID, and we'll see you back here on Friday as we continue to bring you real talk and reliable information about this awful, awful disease that's impacting our community. Thanks, everyone. Have a great day.